I'm sure you've seen the last 2 days the images from the border or the border crossings in and out of Metro Manila. From a health perspective, or a health point of view, from a quarantine point of view, how do you assess what's been going on?
Well, definitely, there needed to have been better plans in creating social distancing in these checkpoints. It seems that people really crowded
Hmm.
and formed lines that created close contact with other people, and that actually defeats the purpose of what we wanted as community quarantine. So I think new measures are probably needed at those checkpoints to ensure that there is more order.
Doc Susie, you talk about social distancing kasi hanggang ngayon meron pa ring mga panic buying sa mga supermarkets and pharmacies. Pag nakita niyo yung mga linya doon, dikit-dikit mga tao, all within cuffing distance of each other. What can we do about that? Anong sitwasyon doon kapag ganon?
But, this is really in the hands of every citizen. I think we want to have rationing of food. And I think government is giving us all a chance to do this through our own discipline. It was already said groceries will not be closed. We should follow that because this is for our health that we don't congregate. The churches have already followed.
Yep.
Schools have followed. It is now citizens, and it's in their hands to avoid these crowds. I would think that if you see a line in a drugstore, go home and go back another time. Don't join the line. If you see an elevator that's full, don't ride. If you're in a supermarket and there's a line, go home. I think some of it is really just driven by fear. Do we need the police to create a line for us in grocery stores? I think we all need to contemplate that scenario. We don't need that. We can do that on our own. Now, if we still cannot control ourselves, then maybe local governments will think of ways for certain people to be able to go to a grocery at a certain time on a certain day. So, if we're waiting for someone to enforce the law and we're not willing to do it ourselves, that's what we're going to get.
Yeah, but Susie, I think that point is well taken and it's very valid. But I'm just basing it on the pictures that I'm seeing on social media and what people are reporting. When it comes to our own communities and drugstores, groceries, I see a lot of pictures where people do take the initiative to do social distancing. I think that message is there. Most of the clustering and congregation that we have seen, really the worst clustering, has to do with the curfew and has to do with trying to get in and out of Metro Manila. Now, there's obviously the geographical matter, but there's also the time matter of people trying to beat a specific deadline, trying to beat a certain hour to get out. Do you think that the curfew announcement and these time-bound restrictions are actually creating an unintended effect of making people rush to the boundaries all at the same time?
It's very difficult to anticipate what will work and what won't work. And I think leaders have to use their best light to try to determine how to control movement of people. To me, the curfew significantly decreases movement of people. But if people are not changing their working hours, they're not making adjustments, and they're just doing business as usual, then there will be choke points. So everyone needs to adjust to this. Everyone thinks their own business is the most important thing, I think we really have to accept that there are going to be changes in the way we live, the way we move around for 1 month. So there could still be a natural denial about the fact that there is going to be limitation of movement. And I hope that people will comply so that we will not need to have law enforcement making us do or forcing us to do things.
Doc Susie, sabi ni Secretary Anyo, at the rate the virus is behaving baka daw in 5 months we will have infections of up to 75,000 people. Is that a valid assessment, valid warning?
I think that's a warning that could be valid if we do nothing. That's not true. We're not doing nothing. I think, you look at the decongestion now in terms of traffic. You look at the people who are at home, the kids who are at home. Even what we're doing just now already has a significant impact on transmission. However, we will not see a flattening of this curve until 2 weeks.
2 weeks.
Because there are still people who were sick last week, who were infected last week, but who may not have any signs and symptoms until this week. And they may still be interacting with people. So give it 2 weeks to work. This is not an easy thing for any country that has done a lockdown. It's very difficult. And it means we will have to sacrifice. But this is the only thing we have now in public health because we do not have a vaccine. You have to keep people away from each other, and people need to stay home in order for that to happen.
Dr. Pineda, this has obviously been a first for everyone. Everybody's going through this. There's really an element of everybody trying to do their best. At the same time, everybody kumakapa-kapa. Now, there are already some reports of some cases outside of Metro Manila. Are there things that LGUs outside of Metro Manila can already learn from how LGUs have gone through it these past few weeks here in Metro Manila?
Okay. The good news is that we have some brilliant local governments out there who know what to do. For example, in some provinces, if you get down from the bus, or last week if you got down from the bus, you have to register. You have to tell them where you live, and the barangay knows where you are. In some places, all people who came from Manila are on self-quarantine for 40 days. In some places, all those who just traveled, let's say, last night or so, are being monitored by the barangay captain. So there is now a clearer way of finding out the potential sources of persons who might be carrying the virus because of these LGUs that have, in fact, been empowered to do their own monitoring. And so many LGUs are clamoring for more testing, which is a natural thing. And I hope that in the coming days that this issue will be addressed.